Hello and welcome to Sterilization Standards Unpacked, Navigating Canada's Dental Guidelines, where we'll talk about the evolution of dental sterilization, the people shaping it, and the standards guiding it forward. I'm your host, Sarah B. Cruz, and in every episode, we'll connect innovation to intention, because progress in dentistry doesn't just happen. It's built through consistency, clarity, and care. Here, we'll explore the practices that protect patients, the standards that impact process, and the professionals who set the tone for excellence. Whether you're in the operatory, the sterilization room, or leading a team, this space is for those who believe that quality isn't a checkbox, it's a mindset. Sterilization Standards Unpacked, Navigating Canada's Dental Guidelines is supported by Solventum, creating smarter, safer ways to deliver healthcare and advancing the future of dentistry through innovation and education. So let's get ready to get dirty and go dental. Welcome to Sterilization Standards Unpacked, Navigating Canada's Dental Guidelines, presented by Solventum and hosted on the amazing Beyond Clean Network. Hello, I am Sarah B. Cruz, and I am excited to be your host, where we'll explore how Canadian dental teams are translating standards into practice, one sterilization standard at a time. I mean, nobody really likes to brag about their autoclaves, but I'm thinking that maybe we should start, because we're going to see just how Canada is connecting standards, safety, and the real world of dental care through standard updates. This series is going to be all about conversation and not compliance checklist. The ultimate goal is that we're going to make the technical personal, because every standard starts with people. And that is the exact challenge that the Canadian Standard Association gave when they released the CSA Z314 2023 update. In this 2023 update, they took a lot of different moving parts. They took things from Quebec, Alberta, Ontario, Saskatchewan, all the way to the east coast of Nova Scotia, and they brought it all together to really push and stretch the dental industry to reach further to demonstrate the quality of their sterilization practices. And as somebody who is in the sterile processing space, it is truly amazing to watch a subsection of the sterilization industry go through this evolution. You know, sterile processing, medical device reprocessing technician, we've all been in this space long enough to see that we've all been in our industry and have observed what we call commonplace practices, right? But these standard updates in 2023 just go to show that a lot of the things we call, quote, commonplace are new and revolutionary line items that really speak to patient care, and the impact that they have rolling out into these subsections of patient safety can be truly profound to the sterilization story and the patient safety outcome, because that's what it's all about, right? Patient safety. So whether you are a medical device reprocessing technician checking in from your standard hospital facility, or maybe you work in a dental facility, a private practice maybe, and you're an assistant, a hygienist, really cool if you're a dentist checking in, or maybe you're a sterile processing technician hanging out, listening in from America, you are going to see how dentistry in Canada is translating the language of standards into daily habits and focusing on clarity over complexity. Now, speaking of complexity, let me take you through some of the history that brought us here to 2023 standard updates, right? And let me tell you, it gets a little complex. I'm about to go through a bunch of different abbreviations, but don't worry, because during the entire podcast series, we're going to have practice-defined moments where we take a break, where we go through different practices and terminology that'll bring you right up to speed. Now, let's talk about complex. Let's get in there. So, moving backwards, I started with 2023. Let's go all the way back to 2018. when the CSA Z314-18 came out. Now, that's the Canadian Standard Association 2018 edition that really pushed for clarity in sterilization practices, stating what needs to be done, and frankly, adding the must and the requirement behind demonstrated consistent sterilization practices. Now, in Canada, the CSA Z314 impacts the dental space. It's all looped in together. So when this update came out, dentistry had to pause. Obviously not the appointments because, everybody's got to get their teeth clean. But they had to pause and really start to think about what they were doing for sterilization practices throughout an entire nation. So the entire nation started to act. So in Quebec, they're integrating the CSA Z314 and Health Canada language in 2022. And the Health Canada language came out in 2020, where they provide the federal foundation for medical device classifications, licensing, and reuse validation. They're including the Spalding classification system. They're requiring validated manufacturing IFUs for reusable instruments. And they're going to ensure that imported and domestic devices meet labeling, safety, and performance standards. Then so that's in Quebec, right? Now over in British Columbia in 2017, they're following the BCCDC, which is the reprocessing of reusable instruments in a dental setting specific to British Columbia. And they are already aligning themselves for this pending 2018 release. Now, let's jump all the way over to Nova Scotia on the East Coast. In Nova Scotia, they're consistently using the CSA and Health Canada classifications. They're also incorporating the IPAC, which is the Infection Prevention and Control Manual. So you can see in all these different spaces, all the way out to Saskatchewan, when in 2019, they're utilizing regional infection control policies to reference and find applicable ways to apply this 2018 update. It really took multiple areas by storm. And then last but not least, in 2022, Ontario is utilizing the RCDSO, which is essentially the standard of practice for infection prevention and control for Ontario. And this specific document mandates every dental office to appoint an infection control lead. So throughout Canada, people are responding to this 2018 update in the best ways that they have available to them, right? And most of them are extremely innovated. I loved seeing that there was the incorporation of an infection preventionist into the different facilities, into commonplace practice, right? That is just so amazing. So you have Canada jumping in and doing what they need to do for patient safety. Now, the CSA is looking. Now, while the 2018 is being implemented in the various ways that we just reviewed at 2018, the CSA Z314 is going to push the envelope even further. So while all of this is happening for the implementation of the 2018 standard updates, in 2023, the Canadian Standard Association came out with yet another update. Now, this standard update implied that if it was not written down, it didn't happen. And that, to me, sounds like the introduction of a quality management system, folks. So we're going to take a quick break for our very first practice-defined moment. And when we come back, we'll talk about all the different things that came with the expectations of quality management systems in the dental space. Be right back. It's time for Practice Defined, a quick pause to unpack a key term shaping dental sterilization and safety. Today, we'll talk biological indicators. Biological indicators, often called BIs, are test systems that contain viable microorganisms with a known resistance to specific sterilization process. When processed alongside our instruments, they confirmed that sterilizing conditions were sufficient to achieve a sterility assurance level of 10 to the negative 6, the Canadian benchmark for true sterility. Under CSA Z314, reprocessing of reusable medical devices in healthcare settings, BIs are required at defined intervals and during cycle verifications. New technologies, including super rapid indicators, allow for faster verification of sterilization loads without compromising compliance. That's practice defined. Now that we're one term closer to excellence, let's jump back into today's episode. Hey everybody, thanks for sticking around after that short break, and welcome back to the Sterilization Standards Unpacked. It's still me, Sarah B. Cruz, and if you hung out with us for the first half of the episode, you would have learned a lot of history about Canadian dental standards and essentially the evolution of standards in that space, right? We spent a lot of time going over the different provincial guidelines and interpretations of this 2018 update. Not to mention how dental infection control in Canada gained structure in that early 2000s period, right? Quebec's 2009 guideline was one of the first provincial documents to outline expectation. Ontario followed with the RCDSO IPAC. We reviewed that in the first half, standards of practice. And today, others reference this CSA Z314 directly. Truly phenomenal. Each update has brought us closer to alignment, right? Each update has brought us closer to alignment. So now let's talk about what happened with the CSA Z314 2023 update. This standard really hit home because it made work predictable, repeatable, and trusted. And it really encouraged every clinic to speak the same language of quality so that the patient can hear it too. Because this standard update called for the implementation of validation and essentially quality management systems, right? So in these quality management systems, specifically outlined in Clause 5 of this update, they focused on the documentation of cleaning, sterilization, and maintenance steps, going a step further to include assigning responsibility, including verification, and my favorite, competencies. You can't have a good quality management system if you don't have competencies. Am I right? So clinics must maintain these documented training, verification logs, and equipment qualification records. So let's talk qualification records. These qualification records included the definition of the competencies that they're tracking, initial and ongoing verification, and the training documents used. Not to mention that in Clause 4, they really dove into this concept of risk assessment. It expands on the risk assessment methodology for dental device reuse. The 2023 update stated that the practices must document rationale for classification of critical, semi-critical, and non-critical items, really incorporating that Spalding classification system. And this impacted overall record keeping, which they outlined in Clause 11, the workflow design that they described and demonstrated in Annex B. All of these came together to really impact the monitoring and the testing of sterilization. It's outlined in Annex F, where they describe the biological indicators, chemical indicators, and the use of process challenge devices in dental sterilization machines, and demonstrating that sterility has been met with the appropriate indicators. This annex adds performance verification schedules and records retention recommendation. Most importantly, it establishes the frequency expectation and standardized indicator interpretation, right? Because using a BI, a CI, and a process challenge device is great. But if you don't have a uniform way to interpret these products, you don't demonstrate consistency, right? I think it's safe to say that in the CSA 2023 standard update, it demonstrated a clear way to commit to standards and not just follow rules. It's all about providing this accountability, right? Accuracy, verification, documentation, and transparency are key to what accountability is. And the most impactful part of this 2023 update is that it made very clear KPIs or key process indicators that facilities can use to say, yes, I am, yes, I have, and yes, I will continue to do this. You'll see as we go through this series how our guests are implementing these 2023 standard updates in a very real way because they're going to be sharing their real life experiences. We'll have frontline professional in major facilities. We'll have assistants that work in private facilities, even a scientist joining us later on in the season, and not to mention very passionate industry professionals that want to talk about where the future, even after this 2023 update of dental sterilization, not just where it can go, but how far it can go in all the best ways possible. As we begin to wrap our very first Sterilization Standards Unpacked episodes, I am excited to be your host and can't wait to demonstrate how Canada's approach to infection prevention is built on collaboration, national standards, provincial adaptations, and professional accountability. This series is here to reflect on that, and it is my duty to demonstrate how the professionals connect policies and standards into one well-rounded patient care story. Always remembering that no matter where you practice, the process is what unites us. And what unites us better than a good standard, am I right, folks? Because they all contribute to a culture of safety that defines Canadian dentistry. So be sure to join me next time as we begin exploring what makes dental sterilization unique and how these differences shape the way we define safe, consistent care across Canada. I'm Sarah V. Cruz. See you next time. And remember, keep fighting dirty and solving with momentum. Bye. Thanks for listening to Sterilization Standards Unpacked, Navigating Canada's Dental Guidelines, where we connect innovation to intention and recognize the progress driving dentistry forward. Every conversation here is a reminder that progress doesn't just live in policies and products. It lives in people, the professional choices we make, the standards we uphold, and the care we deliver every day. If today's discussion inspired and motivated you, share it with your team and keep the conversation going. Sterilization Standards Unpacked, Navigating Canada's Dental Guidelines is supported by Solventum, creating smarter, safer ways to deliver healthcare and advancing the future of dentistry through innovation and education. I'm Sarah B. Cruz. Thanks for joining me, and until next time, keep fighting dirty and solving with momentum.